Hello everybody and welcome back to this week's vlog. We're going to follow on from last week's session where I showed you that we should be breathing from our diaphragm and our lower ribs and not using our upper ribs, our neck muscles or our chest muscles. Now, why do people end up with poor breathing habits? Well, a lot of the time it's long-term stress, where you take that deep breath in and then you don't breathe out. So that's where it all comes up to the top, and we don't tend to then let go and breathe through our lower ribs. Now this can happen in childhood, trauma in childhood, or even, you know, being told off at school sometimes can really set you and trigger you. So it may not be a recent thing, it may be something that happened back in your past. Also, the other things that cause poor breathing mechanics are things like asthma and chronic lung disorders. So today we're going to have a look at little exercises to help work our thoracic spine mechanics. So our thoracic spine is from the base of our neck to our lower ribs. So that's the spine in there, and then the rib mechanics, and then the muscles that work all that. And I'm really lucky to be joined by Sara Dennis, who is one of Salisbury's most experienced Pilates instructors. She's been a Pilates teacher for now 19 years and has been in the fitness industry for 31 years, or maybe even 32, she tells me. So, but she doesn't look like she's been in the industry for 32 years. She's still looking lovely and young. So she's going to show us, because I thought I'd get a professional in to do it rather than me, how to do a few little exercises to loosen these mechanics and make us feel better and help to make us breathe a bit better as well. So I'd like you to welcome Sara Dennis. Hello, Sara.
Hi, Rhian.
Hi. So just tell people, obviously with Pilates, breathing is a really core part of all your practice, isn't it? And why is that? Why did Joseph Pilates really focus on breathing?
Joseph Pilates had asthma, so he had really bad breathing as a kid. So he realised, amongst other things, the fundamentals of good health was good breathing. So as you were saying, what we call apis breathing up here, starts from these neck muscles that weren't designed to breathe, and it starts to bring sort of a really unhealthy lung function. Your diaphragm stops working, so you haven't got that lovely sort of jellyfish-like lift and lower of your diaphragm. So yeah, it's really important to breathe correctly, and I'm going to go through some exercises for everybody. So it's my absolute pleasure. Basically, we're just going to remind ourselves of what Rhian did last time, which was the sort of lovely relaxing breathing. So just thinking about your breath as coming all the way down to the pelvis. And when you breathe in, your belly sticks out, you sort of breathe wide into the front and the back of the pelvis. And then as you breathe out, everything softens, and really enjoy that breath out, because it's really important that it's effortless. So it's that breathe into the belly, checking that there's not much movement up here, if any, and then just breathe out. So with that thoracic breathing working nicely, we can then start doing some exercises to get the ribs nice and stretched, because if you haven't been breathing correctly, they can sort of all stick and get a little bit solid. So we're going to do just a nice little rotation exercise. So first of all, we're going to do it not without breathing, obviously. I still want you to be alive at the end of this vlog. So we're just going to twist to the side, keeping the pelvis forward, and then we're going to come back to centre, and then we're going to twist to the left. But what I'd like you to try is that in-breath. So as you breathe in, the belly sticks out and you twist, and it gives you a bigger stretch. And as you come forward, you sigh and relax. So breathing in, grow nice and tall. Breathing out, sighing back to the middle. Breathing in, grow nice and tall. Breathing out, Coming back to the middle, and again, really big breath down there. And then bring it back to the centre. And then we need to do some nice big mermaids over to the sides to open up here. So we want the ribs to be able to move. So we're going to accentuate the breath. The ribs do come out and in by the diaphragm a little bit, and we want to make sure they are moving in that way. We want to really breathe into the lungs. So we're going to take the left arm, and you're just going to lift up and side bend over. And I want you to just take a really nice breath into this, this left side and let them expand. Oh, I love it. We don't do enough side bend in our daily lives. Side bending over again, breathing into that right rib and breathing out. You can do this standing up, you can do it on the chair, you can do it on the ball. You're going to breathe in. Really open up those sticky ribs and bringing it back, and again take it over, take a nice deep breath in and then breathing out. So we've gone all around the breath, we've got the sides. Now I'd like to just focus on the back. We've got a lovely exercise called the cat in Pilates where you can do just that. So you can do this on the chair. If it's more comfortable for you to come down onto elbows and heels of wrists, please do. Or you can just do it with your hands against a wall or on a table. So all we're going to do is tuck the bottom under and roll up with cat stretching, head relaxes down, and then breathe into the ribs. Feel the ribs expand outwards and stretch in a lovely, lovely way, and then uncurling, rippling back to our starting position, and again, tucking the bottom under, squeezing those bottom muscles if you can find them. They are there, I promise. Then breathing into the ribs. And then breathing out as you uncurl. And we'll just do one more, tucking the bottom under. You can do as many as you like. These are so lovely. Breathing into the back of the ribs. And then breathing out as you uncurl. And then thread the needle, which is one that Rhian actually requested, because she likes it. It's a really nice one actually. For thread the needle, you just angle your fingers in a little bit towards each other, and then just put one hand underneath the other hand, and you rotate, and then here, which is gorgeous, and you then breathe in. Open up those ribs, feeling the tightness, and then breathing out. You can hold it for a little bit longer if you want to. You can hold it down there for a couple of breaths. Of course, you only go as far as you can, so if you can only go here, don't push it, just breathe in. I'm still getting a really good stretch, so it's a lovely rotational stretch, this one. Really feels good. Lovely. And then you can just pull back into what we call a shell stretch there. Because I think, Rhian, you want me to go on the roller now, don't you?
That's right. So I'm going to take over just chatting while Sarah just gets into position on the brutal roller. I've been tortured many a time by Sarah on this device. Sounds awful, but she's going to show you a nice way to try and relax on the roller. But what it does is really help to open up our chests, and you can really feel the breath then when you take a nice breath in, coming down into our diaphragm. So back over to Sarah. Hello, Sarah.
Hi! Back to Salisbury. What I'm just doing is lying on rollers. Now, quite often, these rollers are really quite hard. So it's nice if you put a mat or some padding under them if you feel they're uncomfortable. But all we're going to do, really simply, we're going to either hold the arms out like that, or we're going to bend the arms like that. So whichever you feel comfortable, make sure your shoulders are relaxed. And just having that lovely sense of opening through the chest, and then focus on your breathing again. So it's that belly breathing in, and belly breathing, relax, and really make the most of sigh in that breath, because it's really, really lovely just to give yourselves a chance to stop and just enjoy your body. And as your body relaxes, you'll feel much, much less stressed and more comfortable. So that's a really nice way that I work on the roller. I also take my arms over my head like that, but just do what's comfortable for you. Make sure you don't arch the back. Often, if you've got a little bit more of a curve back, I've got a very flat back, you would take a much bigger pillow underneath your head, and that's important that you feel comfortable when you're lying down. So Rhian, what was that exercise you wanted me to do?
So basically, it's just an adaptation of the foam roller, because some people may not have a foam roller at home. I certainly don't, because they're agony. So Sarah's just going to swap positions now, and we're going to roll up a towel. If you're really curvy, you may want to start with just a hand towel. However, if you're not so kyphotic or curvy in your upper back, you can start with a bath towel, which is fine because it just makes it bigger. So Sarah's going to put it under her imaginary bra line. So guys doing this, you know, you've got a good idea where that is, hopefully. And as you can see, she's lying over the towel. She's going to have a pillow under her head. You can extend your legs out straight if you feel that's comfortable. People who are quite curvy in their lower back may find that uncomfortable. Now, if you're going to do this on the bed, because you can't get on the floor, then you will need a bigger towel, because your bed will absorb that lovely arching that the towel is going to create. So use a big towel if you're on the bed. And then we're going to just try and relax our breathing. So you're going to spend 4 big breaths to really breathe into the diaphragm. And then you're just going to lay there and just take normal breaths, shut your eyes and go to a place that you think is wonderful. That may be a sunny beach with the waves lapping at your feet. That may be riding a horse. That may be going for a walk in a mountain. Whatever your favourite place is, go there for about a minute or 2, just laying and relaxing. This is great if you're a key worker at the moment and you come home and you're stressed, then have a little go at this. Or just, you know, you fancy really trying to feel where your breath's coming into your diaphragm. This is a great one for it. So Sarah, if you just say something to get the camera back to you in Salisbury.
Yeah, I'm having a lovely time. I'm on the beach in the Maldives. It's great. I'm just waiting for you to bring my cocktail there, Rhian. So I'm just getting a really nice stretch. I'm able to hold it here and just lengthen and just breathing into my belly. And that lovely expanse and breathing out. And if I imagine that somebody's just gently pulling both fingertips in the opposite direction, so widening myself and supporting me, it's like I'm being, you know, just floating on air. I feel an even nicer stretch, a bigger stretch comes across the chest. And I could lie here forever. You're going to have to wake me up, Rhian.
Yeah. See, this position, if you've had a really bad case of coronavirus and your lungs have been really affected, once you're over it, this sort of thing is great for you to start rehabbing your lungs and your chest, because lots of people are going to have quite damaged lungs and it's going to take a long time to get back to proper health. Every day you can't breathe is a week's recovery. So, you know, a lot of people who've been out for 2 weeks with this, you're going to have a look at least 2 months, probably up to 6, to actually get over what you've been suffering. It's going to be a long haul. So some gentle exercises like this will really help you. And especially in that position that Sarah has adopted, just to open up the pectoral muscles, because, you know, even if you were actually in a ventilator and being laying on your chest, all those will be really shortened. So these sort of things can really help if you're recovering from the coronavirus. So that's it for today. I'd like to thank Sara Dennis so much. She is doing online classes during this lockdown. So if you would like to join in some of her classes, Sarah, do you want to give me your details?
Yeah, if you just look on my website at Fitness Design Limited, www. Obviously. And just, I've got some classes downloading, or I'm doing live classes on Zoom. It's really easy to download, and we do have a lot of fun, don't we, Rhian?
Certainly do. And Sarah likes really good pain. Just to warn you.
So do you.
Yes, I must say I have stolen your phrase, and so my patients know when they're having good pain. So thank you. Thank you once again, and I look forward to seeing you next time. Take care, everybody. Goodbye.